So my name's Dr. Suzanne Bartington. As Stephen Holgate has already said earlier in his opening introduction, I work with Gary Fuller and Stephen himself as the Clean Air Champions, as well as our wider team, including Noel Nelson, who's spoken already, and Sarah Muller as well. As well as my role as Clean Air Champion, I'm also a clinical associate professor here at the University of Birmingham. So on behalf of our colleagues here at Birmingham, a really warm welcome as well to campus, and I really hope you have a fantastic 2 days ahead. So this panel is going to focus on inequalities, really picking up on that really personal opening that we had from Sir Michael Marmot. And he does give his apologies. I'm afraid he has had to dash off to another diary appointment, so I'm afraid we won't have the opportunity to put questions directly to him, but we do have a fantastic lineup on the panel, and you will have an opportunity to ask questions as well. So I'm here joined on my right by Agnes Agyepong, and Agnes is the founder and chief executive of Global Black Maternal Health, so welcome Agnes. And on my far left we have Dr. Abigail Whitehouse, and Abigail is a clinician, a senior clinical lecturer in children's environmental health, and an honorary paediatric consultant at Queen Mary University of London. So thank you for joining us, Abigail. And Dame Judith as well here, who you've already been introduced to this morning. So to make a start, we've seen some really, as I said, some very stark figures in terms of the gap in life expectancy in the UK. And we know that people who live and those who grow up in poorer areas have both shorter lives and also more years of life lived in poor health as well. And we also know, and I think this is really timely as well, given the recent Darzi report, that many of the conditions which are handled by the NHS are indeed preventable and require that effective action to address the wider determinants of health. And of course, clean air is very much part of those wider determinants, as we've heard already. So Agnes, I was going to turn to you first. So why is it important to address inequalities, and how can that benefit families and communities?
Well, first of all, thank you so much for having me here today and having me on the panel. I always say I'm the least likely clean air advocate that you would ever get. It's not something that I ever imagined I would be talking about. And not because I'm not interested in the air that I breathe, but it's just something that had never come up in my kind of day-to-day living. I'm from Southeast London, born and raised, very proud of that. And it just wasn't anything that came up. Two things changed that. So one, I'm a mother of three, and I experienced really bad care when I gave birth to my third child. And that kind of propelled my journey to be a maternal health advocate. And I started championing kind of maternal health outcomes, but specifically at that time, I didn't know that black women were 5 times more likely to die in pregnancy and twice as likely to experience a stillbirth. In parallel to that, my daughter at the time was between 4 and 5, and she started getting really, really sick. And every time I was going to a doctor's, they were saying to me, oh, eliminate bread, eliminate milk, just eliminate so many different things. And in the period of about 9 months, she got really, really sick, and she ended up having community-acquired pneumonia. And they had to do a lot of checks on her to find out what was exacerbating. It turned out she had asthma. And that's when I started to really understand the environment that you live in and how that can exacerbate different conditions. But every time I was going within my kind of hat as a maternal health advocate, and we were talking about black maternal health and inequalities and stillbirth, I'm thinking if this can happen to my daughter can get really, really sick, then what can happen to a kind of baby in utero? What can happen, when you're kind of bringing forth life and looking at the environmental factors that women from poorer communities and from black and marginalised communities are experiencing. So that kind of propelled my journey into being a clean air advocate and the work that we now do.
Thank you, Agnes. I think that's a real relived experience that you share and have shared with us. So Abigail, I was going to turn to you next. In terms of you obviously work clinically and in a challenging, relatively deprived area of London. What do you see clinically manifest in terms of the inequalities in air pollution exposure and its impacts?
So is that working? Is that working? Yes. So it's really interesting. I came through paediatric training and medical school and didn't really ever hear about air pollution or the environment. It was something that other people talked about in other degree courses. I've come through training advocating for patients because they present with asthma and significant respiratory illness, and thinking about things like exposure to cigarette smoke and all those bad things that we do to each other. But actually, one of the key areas that we have issues with, particularly in North East London, if anyone saw the slide earlier, Newham and Tower Hamlets, top right-hand corner, some of the most deprived areas of London and also some of the most polluted. And what I see in clinic is just the tip of the iceberg. I see children with asthma attacks and exacerbations that we think are probably due to that exposure to pollution. But it's actually the children I don't see in clinic that I worry about the most, the ones that are repeatedly going to their GP or to primary care, that have poor housing and they have no access to the knowledge and the understanding and the education that could help them to improve the environment that they're in, but also be aware of what that environment is. And I think it's a really difficult conversation to have, to say, actually, you live next to a main road and that's making your child's health worse. And as a clinician, we forget to have those conversations, and I'm lucky that I have the time and the provision that we have a clinic where we can have these conversations, but most clinicians don't. And I think that's a key thing going forwards, is making sure that clinicians like myself, but also in the adult medicine, also have opportunities to have those conversations as well.
Thank you, Abigail. And Judith, I was interested in your thinking. We've obviously heard about science and policy and that interface. And we have a new government. We heard from Sir Michael about the Marmot cities, and also I was actually just discussing with him the potential for Scotland to be a Marmot country, in fact, which I think perhaps reflects some ambition around the devolved nations as well. We'll explore that further tomorrow. But I just thought in this sort of policy context that we're in now, because you talked about timeliness of evidence as well, where do you think are the key policy areas where clean air research, such as that by people in this room, can really inform policy to reduce inequalities? It's a big question, I know.
So I think, first of all, we need to get the clean air message into that policy world. I was interesting listening to Louise Heathwaite talking about the areas of, I think she had beyond the carbon, future of environmental security, which is really around geopolitical influences, responsible innovation. In the science world, where does air pollution fit in some of those? And I think that's quite an interesting question. The whole systems approach, it's a wonderful language, and we use it all the time. I actually have a centre for systems analysis at Plymouth. And I think in a complex sort of policy world, where net zero in particular is an immensely strong language, and energy, energy futures are strong languages. Thinking through how clean air fits in there is quite an important task for this group, because it's not always evident as a first topic that gets discussed at all. And understanding clean air in the health system and the poverty system versus other forms of impact on health, like poorly insulated homes, lack of food, wet and mouldy homes and things like that. How do these things fit together? And then final point, prompted by a colleague from Hertfordshire we've just been talking to. Really interesting question in the policy world. Is it possible to influence locally policy directed at particular problems compared to a policy for a whole area? And that's quite an interesting question to ask. Is it all right for a local authority to say they're going to put their money and their emphasis on control in particular areas, particular housing, particular communities, as opposed to a policy response that covers the whole of the county or the whole of the metropolitan authority, whatever the authority boundary and makeup is? And the same for national policy, because we tend to talk about a single policy solution. Is it possible, and this is just an open question, to identify policy solutions delivered towards particular communities, particular parts of our community. What does that mean in terms of cost? What does it mean in terms of policy that doesn't get delivered for others, who may still benefit from certain policy interventions? How do you balance off and trade off that type of policy response? And for me, that's a big question.
And something I know we were keen to explore with Michael, had he been able to stay, was what does proportionate universalism look like from a local authority perspective? But anyway, we'll have to hold that thought anyway. Agnes, before I go to open up to questions in the room, I was just interested if you wanted to pick up on what Judith has just outlined, but how do we include the voices of the communities and people like yourself, your family, those that you've worked with? How do we include that in this science policy interface?
I think one thing, firstly, is to understand that in communities, like in this room, we will talk about NO2, PM 2.5. No one's talking about that on a Friday evening or on the weekend, right? No one's talking about that unless you're us, right? So with that in mind, how do communities understand and engage with clean air? If you came to me, you know, I live in Lewisham Borough, and I've got so many different things I'm thinking about. Cost of living, I'm thinking about how my children are going to school, I'm thinking about, you know, getting to work on time, all these different factors, and then you try and stop me to talk about clean air. I'm going to walk past you, and it's just really understanding how are people living and experiencing the world that they're in, and then intersecting issues around clean air into their daily lives. If you spoke to me about my child's asthma, or for example, if I have a child who's autistic or neurodivergent and they're having sensory meltdowns, and we know, you know, the impact of having fresh air on children who have neurodivergent conditions, how that can help them. Now I'm going to be engaged. So it's about looking at, when we're looking at the kind of clean air movement, how can we speak in a language that is inclusive to where people are at? And I think at the moment we're not doing a very good job of that. We speak in, I say we, I'm not a scientist, but you people, no, I'm joking, but speak in a language that by default is very exclusive, just by default of the way that you speak about these issues, which means you're not bringing the public along. As a result of the work that we do, we produced a report called Black Child Clean Air. And I remember initially when I was promoting, respondents to take part in the research, they were like, Agnes, what are you doing? Clean air, what's going on? And as they were taking part, they would message me and say, oh my goodness, Agnes, like based on this question, I was in A&E with my child the other week, or I've been having multiple miscarriages. Like all of a sudden, the questions in and of itself made them realize that actually this was something that was of interest to them. And that was because the segue that I came in was around maternal health, reproductive health, something that was interesting to them. And then I layered the issues of air quality or air pollution into that. So I think it's really about, as opposed to we have all these knowledge as scientists and researchers, so you now need to learn about these new terms in order to engage with us. How are you actually communicating with communities where they're at and actually, moving along? Because nobody cares more about their communities, their families than them. I have 3 children. I care more about my children than anybody, and I should do, right? And so if we know that all these health impacts are happening to our children, to our families, and communities are not engaging, it's not because they don't care, it's because sometimes the language is really exclusive, and they really don't understand how this is a priority against all the other multiple things that they're already contending against, especially when we're looking at people who already have multiple deprivations already within their communities.
So language matters. Abigail, just before we open up for questions, anything to add in terms of the parents coming into your clinic and how you broker those conversations?
I think you've raised a really important point. Is they come into the clinic and they talk to me, and their main purpose for being there is because their child's been sick and they've had to take days off work, and all the things that come with having an asthma attack in a child. It's not just that your child is ill, it's that your parent has had to take time off work, and so they've lost money that way. They've had to take the train to get into central London to come to the appointment. They've had to take time off to come to that appointment. So they've got all these other worries, and they're worried about health. And then I come out with, and so do you live next to a main road? Is that really important to them? Well, it's not at that point in time because they want to know how to treat the illness. But actually, when we have a time to have a longer conversation about it, well, actually, I can now talk about your housing, and I can talk about what state your house looks like, and I might be able to bring this round, and I might be able to help support and advocate for you in terms of fixing some of those problems in the house. I'm not going to be able to move you from one place to another and remove the pollution, but I can support you, and also we can use your story to promote policy change and think about where we're building all these different things. And I'm sure people will have seen the latest report around the campaign from Asthma and Lung UK around playgrounds and play school and the playgrounds that children play in. And that's because we build them next to main roads because they're accessible. And I think that's because that's where that point came from. But actually we need to be turning everything on its head and going, no, what we need is clean air. And how do we get that for everybody that we're looking after? And how do I then pull this into clinic in my 20 minutes in my NHS clinic is a little bit more difficult.
That's the challenge, and the challenge for the NHS as well, moving forwards. So I'm going to open this up. We've got 2 roving mics, one on either side of the room, and really keen for some questions to come forward. And if you can also say your name and introduce yourself as well, please. We have one over here, which is from Noel.
Hi, thanks. Several questions, actually. I'll try and make them really brief. One to Agnes about within the black community, how much of a problem is it that some in the black community have a slight mistrust of the medical fraternity, and maybe it's because of years and years of not being listened to, etc., but there's a perceived problem there, how one gets over that. And also to Abigail, if you're in a situation where you're having to tell people that unfortunately